with 6 News at 11.
State lawmakers are spending big on mental health services as federal officials look to make it easier to access. It's our top story tonight at 11. Thanks for joining us. I'm Sherry Jones.
And I'm Siobhan Klepfer. The state's largest budget, coming in at $81 billion, aims to support major programs in areas ranging from education to mental health.
And millions are earmarked for health clinics across the state, while D.C. lawmakers want to add their financial backing as long as it meets certain criteria.
Josh Sanchez has more on what that expansion looks like tonight. Josh?
Sherry, Siobhan, U.S. Senator Debbie Stabenow toured Lansing's Community Mental Health Authority of Clinton, Eaton, and Ingham counties with other federal health leaders. It was part of her trip to the capital city to get a closer look at how these clinics are connecting with the people who need the help the most.
This is about health care. Healthcare.
U.S. Senator Debbie Stabenow pushed the need for federal help in tackling mental health and substance abuse nationwide. At Community Mental Health, she met with more than a dozen county and city leaders who shared the benefits and the success stories of having a resource like CMH for people to go to day or night. For more than a year now, the clinic has been part of a program that gets some of its funding from Medicaid dollars to help cover costs. Stabenow says along with new state funding, people can access well-rounded care without the burden of not having insurance.
You can get physical health care and behavioral health care at the same place and be able to get crisis services, and that's the comprehensive care that's going to make a difference for people. It also saves a whole lot of money.
Federal health leaders say this type of model meets people where they are and brings services together into one place, like primary health care and substance abuse treatment, and in turn reduces jail time, homelessness, and trips to the emergency room.
We know it's making a meaningful difference, and so certainly that's something that we're excited about and excited to continue to partner with you all around advancing this really important model.
The Michigan Health and Hospital Association praised the state's new budget for setting aside $92 million for inpatient psychiatric services and trauma centers. Sarah Laurie with Community Mental Health says the move brings hope and that this type of care becomes more widespread.
Opens the doors in terms of access to care for anyone in need, meets them where they are, and it fills some of the gaps that we've been struggling with in our behavioral health systems.
Senator Stabenow says the federal project looks to add 19 other clinics to part of more than 500 locations around the country. Back to you.
Thank you, Josh. Speaking of